Hi, I'm James Zensky, and we're here at Parkland Medical Center in Derry, New Hampshire. Tonight we're joined by Dr. Mary Fudge. Thank you so much for being here.
Absolutely.
I want to remind our Facebook viewers that we'll be recording this live, so please put any comments, put any questions, and this video will be available on our Facebook as well as YouTube channels. So, Dr. Fudge, can you just tell me a little bit about your philosophy, general surgery?
Yeah, absolutely. I'm a general surgeon here. I've been doing general surgery for just over 10 years now. I think for me, one of the greatest aspects is that patients come to me with a problem, something that's either causing them pain or affecting their quality of life, their ability to work, and I can fix that problem and send them back to work, hopefully pain-free and without their problem anymore. So it's very much like an acute issue. We fix it and they're better. So I feel very passionate about helping people with those problems.
All right.
And like I said, I've been doing it for about 10 years here in Derry.
And as our audience at home can see, we're actually standing in front of the Da Vinci Si robot. So, Dr. Fudge, let's just start off. Let's get this out of the bag here. What are the common myths about robotic surgery?
I think most of the time patients come to me and they think a robot is going to do their surgery, like Data from Star Trek is going to be walking up to them and doing the operation, and I'm just sitting there typing things in, and that is not at all what it is. It is an extension of me and an advancement of technology that only makes surgery better. And I think that's probably the biggest misconception. The second one is that patients think it's going to cost them more, and it does not cost patients more.
Wow.
There's no increased cost to the patient whether you have the surgery done with robotic assistance or laparoscopic. Both are minimally invasive, and from a patient standpoint, it's the same cost. And then finally, some people think it might be riskier because I'm not involved somehow, but I am in the room, I am doing the operation, there's no increased risk to the patient, there's actually probably less risk. And it has to do with some of the things that robotics offers that we're going to talk about later in terms of the camera and the instruments.
Okay. So being a general surgeon, what kind of cases can be done on the robot, and what kind of cases are you currently doing on the robot?
Yep, general surgery right now that I'm doing on the robotic, or robotic assisted, we should say, is hernia surgery, primarily inguinal hernia or ventral, which is any hernia in your abdominal wall, or gallbladder surgery. And in addition, we are doing single-site gallbladder surgery here, which means there's one incision as opposed to multiple, which traditional laparoscopic surgery is always done with multiple incisions here. And there is general surgeons doing robotic colon surgery here for removing, for instance, colon cancer or for diverticular disease. It's not really what I primarily do, but that is available as well.
Okay. And so I'm a patient, I come to your office. Am I a good candidate? Who's a good candidate for this robotic assisted surgery?
I tell patients anyone who can have laparoscopic surgery or minimally invasive surgery can have robotic assisted laparoscopic surgery. It's just an extension of what I'm already doing laparoscopic. So unless there's some reason you couldn't have laparoscopic surgery, which is pretty uncommon, most patients are good candidates.
Okay. Now this all sounds really cool, but me, the patient, I'm a candidate. What are the benefits? What do I get out of this?
The biggest benefit from a patient standpoint is less pain after surgery. Most patients who have robotic assisted surgery do not need narcotics afterwards, or very, very little. And that has to do with how the robotic assistance works. It causes less trauma on the tissue. There's less trauma inside the patient too in terms of what I'm doing of my dissection. There's less trauma, so less pain afterwards. Quicker recovery, most patients are back to work sooner, and length of stay at the hospital. A lot of these are outpatient procedures, but there's still a shorter length of stay in the recovery room. And for patients who are undergoing colon surgery, there's usually a less length of stay in the hospital. Their total length of stay is less. And then incision for single-site gallbladder surgery, obviously one incision in the belly button, which is practically hidden, is very nice. Instead of having four, they're small, but there's still four incisions with traditional gallbladder surgery.
So it sounds like excellent benefits. Well, let's get to the fun part.
Yeah.
Let's see how this thing works. I'd love to learn more.
So this is what surgeons call straight stick, meaning traditional laparoscopic surgery. It's called straight stick because it's straight. You can only open and close it, and you can rotate your hand or the instrument. So you can see it rotates. See that well? Right there? And it opens and closes. So when you go into the patient, there's very limited motion that you have. When I go on the Da Vinci robot, you'll see that my range of motion here at the tip has like a wrist. So instead of it being as if someone's holding your wrist and not allowing you to move your wrist, here I'm allowed to move it, open and close, and it gives me a lot more motion inside the patient. In addition, the movements are very fine. So instead of being kind of clunky almost, they're very, very precise, fine movements. And finally, the camera itself is much improved compared to the traditional laparoscopic camera. It's 3D in the console, and the magnification is much more profound than it would be on a traditional camera. So I'm going to jump on and do a little movement and let you see what that looks like.
So now we're going to go on over to our console where actually Dr. Mary Fudge will be sitting, and we'll kind of be jumping back and forth as she gets set up. So we'll head on over there.
So after the instruments are placed in the patient, which I would do with the assistants stay there and I come over here, and this is where I'm now using the instruments with these finger panels to control the motions. So there is a microphone, so if the audio is a little weird, that might be why. But if you go over to the model, you can see that I have that range of motion I was talking about. And James, you might want to chime in terms of that. So you can see the up and down twisting motion. And obviously these aren't secured in a patient, so it's not quite the same as it would be if it was secured in a patient. You can pick up that range and move it to a new location. I can pick it up. I can move the camera in, get very, very close and see details like vessels and nerves that you may not see as well in the traditional camera.
And now how about when you're closing up and your sutures? I mean, this is all done via the robot as well?
Yes. For instance, let me come over here so you can hear me. So for instance, with an inguinal hernia, a traditional laparoscopic surgery would be done, you would just place the mesh over the opening or the defect. With this, I can actually close the defect, so the repair is much better. It's longer lasting, less chance of recurrence, and less pain. And again, this instrument allows you to have a lot of range of motion with your wrist. One of the things with the camera we wanted to show you, which is pretty interesting, I don't know if you can look up there. This is a $5 bill. And I don't know if people realized, but on the $5 bill are the states.
So that's just how good the camera is, and making it so much easier for you to be able to see everything that's going on.
Are there any questions?
I don't think we've gotten any thus far, but I highly encourage people, whether you're watching this live or watching this later on, to please go on, again, make those comments, put those questions online. I know that Dr. Fudge will be answering those questions. And we also encourage you to visit our website, which is parklandmedicalcenter.com. Like I said, we'll have this video up on Facebook. And this is great. We really appreciate your time coming out this evening. This has been really cool to learn about, the Da Vinci SI robot here at Parkland Medical Center. And I think what's really most impressive, we broke a lot of myths tonight. We don't have data from Star Trek who's doing it for us. There's a lot of benefits to the patients. Getting back to work faster. I mean, what are your patients seeing? Are they getting back to work a little bit sooner than traditional surgery?
Oh yeah, I think that even with gallbladder surgery, removal of the gallbladder, which traditionally patients do go back to work fairly quickly. Most patients are back to work in a week or two. I've had patients go back to work in 2 days, requiring no narcotics. And hernia patients requiring no narcotics only taking over-the-counter pain medication and able to go back to work within a week. So it's really made a huge difference for patients in terms of pain control and back to work. And I think that's, from a patient standpoint, probably one of the most desirable things.
Cool. Well, this has been an excellent program. I know I've learned a lot. I'm sure the folks at home have also learned a lot. So again, please, comments, questions, put those on Facebook. And Dr. Fudge, thank you so much again for joining us in this great program.
Absolutely. Thanks.
Thank you.